So to get started, so as we all know, uh, this on March 11, World Health Organization has declared this rapidly spreading coronavirus outbreak as a pandemic, which means that this virus will likely spread to all countries of the globe. Even if we haven't have these cases in our place today, we'll likely have it tomorrow. So we all need to be prepared for this infection. As of 12th of March, more than 129,000 cases have been confirmed from 114 countries all over the world. And more than 4,700 people have died from this disease. Coronavirus is a family of viruses. It is an RNA virus, and the name corona is derived from a protein spike that projects through viral envelope, giving it a crown-like appearance. In Spanish, corona means crown. Coronavirus are usually common amongst bird and mammals, with bat being the host to the large variety of genotypes. So how common is coronavirus? It's quite common. Actually, it's found everywhere. In respiratory seasons, especially in winter, we see a lot of patients being infected with this coronavirus. It usually causes respiratory infection. It spreads through direct contact or through infectious secretions, and it can even cause a small outbreak in long-term care facilities in elderly patients. And this is not the first time we have seen outbreak from coronavirus. As I said it, in 2002, we had SARS outbreak that started from China, infected over 1,000 people and killed more than 700 people. And it had a case fatality rate of 9.6%. Then we had MERS outbreak in 2012, started from Saudi Arabia. It infected more than 2,400 cases and killed more than 850 patients. It had a case fatality rate of 34.4%. So what is this novel coronavirus? So towards the end of 2019, there was a virus which was causing cluster of pneumonia in Wuhan city in China. That was initially called 2019 novel coronavirus. Later on, World Health Organization designated the disease as COVID-19. And since then, we have seen these patient with COVID has been significantly increasing throughout the world. As of today, or actually as of March 12, more than 129,000 people have already been infected with this virus, killing more than 4,751 patients. So this is daily new cases throughout the world, and you can see numbers has been progressively increasing every day. Good note, looks like China has been able to contain the disease, but outside China, number of cases has been exponentially increasing since end of February. So how does it spread? Mainly through respiratory droplets. When somebody coughs or sneezes, the respiratory droplets is ejected around 6 feet, and some of them floats around in the air for some time. The rest of it goes and settles down on hard or soft surfaces. If somebody happened to come in that area and inhale the droplet, that person get infected. Or when that person touches the surfaces contaminated with these respiratory droplets and then touch his mouth, nose, or eyes with his contaminated hand, that person gets infected. And there has been also report about patients sharing the virus, spreading the disease without having symptoms. So like any other coronavirus or flu or rhinovirus for that matter, it is a respiratory virus. So it infects upper respiratory airways, lower respiratory airways, and lungs. So symptoms are mostly fever, dry cough, and shortness of breath. There has been some report of GI symptoms before onset of respiratory symptoms like nausea, vomiting, diarrhea, but that's not very consistent. And as I said earlier, a patient can be asymptomatic after being infected with this virus. I don't know if it's a good thing, but the optimistic thing about this virus is majority of the patients, more than 80% of the patients have very mild symptoms. It's like flu. They have mild low-grade fever, cough, and the symptoms goes away. Around 14% of the patient have severe disease requiring hospitalization. They have pneumonia. Around 5% of the patient gets really, really sick, and they need admission to critical care unit. And if you look at the bigger picture, most of the patient recover, and overall, it has a case fatality rate of about 3.5%. It varies also, next slide. But the case fatality rate varies somewhere in between 2 to 4%. When they did the sub-analysis of the patient who died of this infection, you can look at it here. Most of them were 60 years or older. So the older you are, the higher the risk of dying from this infection. Patients who were 80 years or older had more than 14% risk of mortality. Also, the risk were higher on patients who had cardiovascular disease. It looks like it was the highest risk. Diabetes, chronic respiratory disease, uncontrolled blood pressure, and cancer. So overall, elderly patients with these medical comorbidities had high risk of mortality, whereas the younger patient, healthier patient, tend to have mild disease. So how contagious or deadly is the disease as compared to some other infectious disease? So I don't know if you can see this slide. COVID is somewhere in the center towards the left bottom. So the y-axis shows the disease with higher mortality rate, whereas the x-axis shows the diseases which has higher transmission rate. Measles, norovirus, chickenpox, these are highly contagious disease, much more contagious than COVID-19, whereas bird flu, Ebola, MERS, tuberculosis, Spanish flu, these has much higher mortality rate as compared to COVID-19. COVID-19 had a transmission rate of about 1.5 to 3.5, which means one patient of COVID-19 transmits disease to about 1.5 to 3.5 people. It has, as I said earlier, it has a case fatality rate of 0.7 to 3.4%. And this shows the case fatality rate in different countries. China had the highest number of cases. There were more than 3,000 deaths, case fatality rate of 3.9%. And for some unknown reason, Italy has a very high case fatality rate of almost 6.2%. Yes, we certainly are really anxious about this COVID-19, but we have seen disease which are much more deadlier, which kills much more patient on daily basis than COVID-19, and these are a few of the examples. Tuberculosis kills more than 3,000 patients a day. Hepatitis, pneumonia, HIV, malaria, all these diseases, they kill more than 2,000 patients a day. So how do we prevent coronavirus? As we do not have vaccines to prevent coronavirus. And based upon what we know about how it is transmitted, the best way to prevent this disease is by breaking the chain of transmission. So washing hand hygiene is the most important thing to prevent coronavirus. And it's not just washing hand, you should have a proper technique. Hand washing should be for at least 20 seconds with soap and water. And if soap and water is not available, you should rub your hand with alcohol-based hand sanitizer for 20 seconds. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover a cough or sneeze with a tissue to prevent the spread of these droplets. Avoid close contact with people who are sick. Clean and disinfect frequently touched objects and surfaces for the reason I stated earlier. And certainly stay home when you're sick to prevent spread of disease again. Okay, so next question is, how long does coronavirus survive on soft or hard surface? It's unclear how long it can survive, but based upon the report from World Health Organization, it can survive anywhere from few hours to few days based upon the surface material or weather. But looks like it gets transmitted much more efficiently through hard surfaces like table surfaces, doorknob, elevator bottom, as compared to soft surfaces. It has an incubation period of 2 to 14 days, but seems like most of the symptoms appear around 5 days after being exposed. Most of the patients, almost 80% of the patient, they have mild symptoms, flu-like symptoms. They recover within few days. People who have pneumonia might take few days to weeks. In case of severe life-threatening illness, it might even take months to recover from this illness. Now, does wearing mask help? So, this was a big question when the disease started. So, as we all know, there are various different kind of masks and respirators. These two are the more commonly used ones. The one on the left side is surgical face mask, which surgeons use while doing surgeries. And probably everybody knows by now that this does not protect us from contracting the disease. This is not meant to protect from such kind of infectious disease. If somebody were to come and sneeze or cough, or somebody who is sick were to come and sneeze on your face, viruses can get through the mask, either through underneath the mask, by the side of the mask, or even through the mask. So it does not protect you from contracting the disease. The mask on the right-hand side, which is called N95, is the one which protects people from contracting the virus, but this is not something that you can wear on a daily basis for daily work. Two conditions where the surgical mask, the one on the left side, can be beneficial is if somebody is sick and that person is wearing, just because it will prevent spread of respiratory droplets, and to the healthcare worker or the family members who are taking care of the patient. There has been report of coronavirus RNA being detected in stool, the significance of which is unknown. It's not known whether the virus gets transmitted by food, but certainly if a food handler is infected and if he doesn't follow the hand hygiene, there is a good chance that he might transmit the virus through the contaminated food. Now, the other big question is travel. When somebody is infected, the recommendation is that they should avoid public transportations, and if they have to travel, they should wear mask. For healthy individual, as we all know, the situation is changing quite rapidly every day. The places that were safe yesterday is not safe anymore today. So we need to keep updated with travel advisories, from regulatory agencies, and certainly we need to avoid going to places with high prevalence of this disease. Effect on pregnancy: there is no laboratory evidence to suggest transmission of this virus from mother to neonate. There has been 2 neonatal cases of infection. One of them acquired disease on 17th day, and it was thought to have transmitted from a caretaker who was also infected. The second neonate, it is unclear how he acquired the disease. The only significant thing on pregnant or significant thing on pregnant women getting this viral infection is looks like the sequelae seems to be more severe in pregnant patients. Otherwise, management of the pregnant patient is pretty much similar to what we manage or how we manage non-pregnant patients. Is no evidence to suggest that this virus gets transmitted through blood transfusion. As we all know, there's no vaccine available, though the scientists are working on it, and it will be several months or even a year before we get vaccine for this infection. Treatment: there's no specific treatment or no specific antiviral treatment. Treatment is all supportive care, giving fluids, antibiotics, oxygen, mechanical ventilator if patient has respiratory failure. If you suspect bacterial infection, treat with antibiotics. Now, there has been some report of compassionate use of some antiviral drugs, antimalarial drugs. Now, I can't speak much on those medication, but looks like there is some promising result out there. There's no evidence to support vitamin C probiotics for recovery from this infection. So that was overall presentation for coronavirus. Now I just want to share how we have been managing these patients at hospital level. As I stated earlier, it is when somebody is infected, the person is highly contagious, and the key to prevent spread of disease is by proper screening, identification of the patient, isolation, management, and prevention of spread of disease. So again, the key is identifying the patient. So in our hospital, we have visible, posters, pamphlets, signage requesting visitors, not only patients, any visitors with fever or recent international travel with respiratory symptoms to immediately notify a healthcare staff. These patients should not be roaming around in the hospital. Any patient that comes to the ER, they will be screened for any febrile respiratory illness. If they have febrile respiratory illness, they will be given a surgical mask. They should wear a surgical mask. Now, if they have the initial screening question positive, if they have any respiratory symptoms, then we ask about the other risk factors as recommended by CDC, which would increase the chance of having COVID-19. So the criteria are: number one, fever or signs or symptoms of lower respiratory tract, lower respiratory illness like cough or shortness of breath, and epidemiological link, which is that person being in close contact with a laboratory confirmed COVID-19 patient within 14 days of symptom onset. So basically, symptoms and a close contact would increase that patient risk of having a COVID-19. Other one is having similar symptoms and a history of travel to a highly affected geographic areas within 14 days of symptoms. The third category is a patient who has a bad pneumonia, ARDS, patient going to ICU, requiring ventilators, with everything tested negative, no influenza, so you don't have explanation for the pneumonia. So if the patient meet any of these criteria, then this patient will be tested for COVID-19. So as soon as this patient meets this criteria and has a potential chance of having this disease, these patients are moved to a private room with the door closed. Patients should wear a surgical mask already, as I stated earlier. Now the recommendation, it is a little confusing because WHO and CDC has different recommendation on what kind of isolation precaution these patients should be on. As per WHO, patient can be on droplet precaution, which means we treat this patient as if they have influenza, private room, and the healthcare provider can wear N95 mask or a respirator, whereas as per the CDC, these patients should be on airborne isolation, which means we treat them as if they have tuberculosis. But what the hospitals in the United States have been doing is initially when the flow of the patient is low, they are more aggressive with isolation. They are on airborne isolation, but as you get more and more patients, suddenly you adjust your negative pressure room, and then they downgrade it to respiratory isolation. Staff has to wear N95 mask, eye protection gown and gloves, as I stated earlier. WHO was okay with surgical mask. All the supplies, if possible, disposable supplies should be used, and for certain equipments, it should be dedicated for a particular patient. For instance, if you're using a stethoscope for a particular patient, that stethoscope should not come out of that patient room. Any shared equipment is cleaned and disinfected with hospital-approved cleaner disinfectant. If possible, patients should be on airborne infection isolation room. We call it AIIR or negative pressure room. Uh, but if you adjust those rooms, then private room is fine. But if you anticipate any patients undergoing aerosol generating procedures, those patients needs to be in negative pressure rooms. What are these aerosol generating procedures? If you if you anticipate patient is going to go are going to undergo intubation, extubation, bronchoscopy, autopsy, CPR, BiPAP, CPAP, placing or extending tracheostomy tube. Basically, if the patient is sick, there is a pretty good chance that patient will undergo any of these procedures. And this sick patient needs to be on negative pressure room. So as I said earlier, if the patient meets the testing criteria, they are tested for coronavirus. In the United States, still the criteria is quite strict, and not all the people who comes in saying, oh, I came in contact with this individual who I think has coronavirus, or I traveled to California where where the prevalence is quite high, and now is coming with a cough and fever. Not all these patients get tested for coronavirus. They have to have a specific risk factor, as I said earlier. Those three risk factor or have to meet those three criteria to get tested for coronavirus. So once you admit the patient, you need to send the specimen for testing. So what are the specimens? So the CDC recommends upper respiratory samples, which is NP, OP swab, nasopharyngeal swab, and oropharyngeal swab, and if possible, one lower respiratory sample. If patient is having a productive cough, sputum, or if the patient is having, if the patient is intubated, bronchoalveolar lavage or tracheal aspirate. And all of this is aerosol generating procedure. So patient needs to be in negative pressure room to get low respiratory samples. While we're treating COVID-19, we should not forget that there are a lot of other causes that commonly causes pneumonia. So if the patient has bacterial, if you think patient has bacterial infection, they should be treated with appropriate antibiotics as well. So patient disposition, when do we deem them non-infectious? So you admit the patient, give them supportive care. After a few days, fever resolves, symptoms gets better. And then you test for COVID-19 again with the same samples that I stated earlier. After the first test come negative, you repeat the test, second test within 2 hours. Both the tests are negative, then that person is deemed non-infectious. Well, while we're taking care of the patient, when there is increased flow of these patients in the hospital from the administrative standpoint, there are a lot of other things that also needs to be managed. One of them is visitor. More the visitor, there is a higher risk of transmission from patient to unexposed population. In the meantime, visitors can be asymptomatic carrier. They can transmit the infection to the patients. There are a lot of risks. A lot of unnecessary visitor will use masks and gowns and whatnot. So a lot of hospitals are restricting visitor to COVID-19 patients, and at the most, they allow one visitor at the most. And as I said earlier, a lot of these patients who are tested positive, they will have very mild symptoms. They doesn't need to be in the hospital. So they are discharged home with the instruction to self-isolate. They should be using, or basically they should not be sharing their room, bathroom, linens, utensils, anything with any other family members. That's basically self-isolation. And once their symptoms get better, well, they have to monitor the symptoms. If the things gets worse, they have to report to the hospital and get admitted. But as long as they are getting better, um, uh, once their symptoms gets better, they are again tested. And one, as I said earlier, when 2 tests comes negative, they are deemed non-infectious. If these patients require surgical procedure, they should be scheduled last case of the day, and should only undergo surgery if it is absolutely indicated, if it cannot be delayed till the patient recovers from this COVID-19 infection. And in the OR, all the protocols for the tuberculosis should be, isolation protocol for the TB should be followed for COVID-19. So that's my presentation. Thank you very much. If you have any question, I'll be happy to take the question.
Dr. Prakash, कसैलाई क्वेसनहरु छ केही क्वेसनहरु छ भने हाम्रो मोडरेटरहरु हुनुहुन्छ डाक्टर विष्णु डाक्टर अमित अन साइड अनलाइन मोडरेटर डाक्टर क्वेसन हुनुहुन्छ केही क्वेसन छ भने
Thank you, Dr. Prakash, for excellent presentations. And all we know that this is a time, every week it's changing and the different countries are getting the new spread of the virus. So there are a few interactions I would like to bring it up. How is the social isolations now going to the public places? This is how it is important while we are, because in our setup, I feel like we are not diagnosing it because we are not properly testing it. And also it's not available. Most of the, only in Kathmandu, only in one places we are able to test it. So how you feel that, what are the measures we should take it rather than just in the hospital? What are the other measures we can take it so that to prevent the spread of the virus?
Very good question. Yeah. So I think we should learn from what happened in Iran. So what happened in Iran was initially they didn't have any case. They said they didn't have any case, and all of a sudden everybody was infected. Vice president and health minister and a lot of people were dying. I mean, yes, it is nice to know that we don't have cases, but is it true negative or false negative? That is the biggest question. We probably should increase the surveillance. As I said earlier, increase screening of the patient with respiratory symptoms. Are we doing adequate testing? Are we doing adequate screening? So that's the only way to find out if we really have cases. Now, coming to the next question, there is a term that's becoming quite famous these days. It's called social distancing. A lot of states, a lot of cities have banned social gathering. They recommend not to go to a crowded place. A lot of tournaments and games has been canceled in the last 2 days or so. All the major events actually have been canceled in the last few days. So how is that going to help? So now, since it has been declared pandemic, it is estimated that in any community, 20 to 60% of the community will get infected eventually. So in that community, every hospital or the healthcare system has a threshold how much they can handle. Okay, so what this social distancing does is, well, 20 to 60% people will get infected, but it will just give time. If say, there is a gathering and 100 people get infected and these 100 people go to a hospital and hospital is not able to manage this patient, it's beyond the capacity of hospital, a lot of patients will die just because they are not getting correct management. They're not getting appropriate attention in the hospital. So they are trying to, there is, I probably should have put that graph on. There's a graph circulating. So they're trying to flatten the curve. Even though 20 to 60% of the people might come to the hospital, they are hoping that the patient comes in a longer duration of time, not to overwhelm not in a shorter duration of time so as to overwhelm the healthcare system, but longer duration of time so that those patients can be taken care of in the hospital properly. So that's how it's going to help by social distancing.
Please.
My question is, what are the advices we give to our nurses, as nurses, to take the precaution?
What are the advices for the nurses to take precautions?
Yeah, what are the advices we give for the triage nurse? Because in our department, nurses are doing triage without taking the precautions which is being advised by WHO.
So again, we need to understand the disease is transmitted through aerosols and through contacts, right? So certainly the people who are in triage is at risk if you're not aware that the patient has this disease. So the first thing is to screen the patient for respiratory febrile illness that as I said earlier. As soon as this patient has a positive screening questionnaire, have these respiratory symptoms, they should be given a mask. And the person who is doing the trial should also wear a mask. And not all the people who comes in with respiratory symptoms have COVID-19 in this season. There are flu, there are a lot of other things. But again, asking more questions. Somebody has had a recent travel to places with higher prevalence. If somebody is coming back from Italy or or Iran or China, and they certainly have higher risk as compared to somebody who is coming from India or some other country with lower prevalence. So if we call it PUI, person under investigation, has higher risk of having the disease, they should be kept in a private room, and you should err in a higher precaution. You preferably should wear an N95 mask. That is the one which protects you from the from getting infected. And there are various degree of exposure risk. If somebody is coughing and sneezing, that will increase the risk of you getting an infection, as opposed to somebody who just have a febrile illness, is not coughing or sneezing. So basically, proper screening, identification, and isolation is the key to prevent our healthcare worker from getting infected from these patients.
Thank you.
I think to add on this, I think the hospital management also has to think about the cleaners and the janitors. Like, we are also always focusing on the doctors and nurses, but there are cleaners and janitors as well who are in a vulnerable situation to get exposure to the infection. So I think we have to think about them as well.
It was a very nice presentation. I have a question. The incidence and prevalence of this coronavirus infection is seen really less in case of children. Is it just a coincidence, or is there really a very strong reason behind it?
Yeah, we don't know yet. Looks like incidence and prevalence is much lower amongst children, which is kind of surprising, because with other coronaviruses and influenza, these are the more vulnerable age groups, the children. But with coronavirus, we haven't seen. There are very, very few cases reported in case of children, and we don't know the reason yet.
I think to add on this, one of the reasons that the children below 9 years of age do not have much symptoms of COVID-19 is also because of the pro-inflammatory response. So what I have read in one of the papers is the disease that you see in the lung, respiratory failure, is because of something called cytokine storms, and cytokine storms is because of a highly pro-inflammatory response in the adults, which we don't see in the children. So that's what I read somewhere in one of the papers, that this could be the reason why we are not seeing the cases in children below 9 years of age.
My another question will be, as we are residing we are waiting for a hot temperature to start at our place, and in India also, is it really that's hot and humid? Because there are not much reports that whether the virus will be able to mutate in this environment as well, because we are seeing most of the recent outbreaks in South Korea as well as in Italy and Iran. They have the temperatures that are again suitable for the virus. But what about India and Nepal, which are now having a hot, humid temperature?
Well, yeah, that question has been raised quite frequently, and people are hoping that as we, as approach summer, hopefully the virus will go away. But there are places like Australia, they are enjoying summer, but there has been outbreak in summer. Outbreak in Australia as well. So we don't know yet if the weather or the temperature will play any role in containing this disease.
Thank you very much for the excellent presentation. I have 3 queries regarding this corona. We got recently as a novel coronavirus, but we get a name as COVID-19. What makes it novel from other coronas? First question. And then second question, no doubt that vaccination is a treatment for this diseases and prevention is the vaccination is the treatment. But when I go through the literature, I come across one of the chemicals that is potent anti-inflammatory that is called chemostat mesicillate that has been used for the pancreatitis treatment. And this corona adheres to the lung tissues and tissue surface of our body by the inflammatory response. So is there any trial that's going on this drug? Two questions.
What was the first question?
What was the first question?
First question was what makes it novel corona? Is there any change in the sequence because the virulence of this disease is from the change in its RNA sequence? What makes it novel, molecular wise?
What makes it
What makes it more virulent than others?
What makes it more violent?
okay? So novel means new, so it is new coronavirus basically. So as I stated earlier, so most of the coronavirus they circulate around in animals and birds, and at times, because of the close proximity with human beings, these viruses tend to kind of jump out of these animals and come to the human being. It's called a spillover, and when they do so, at times they mutate, and when they mutate and come to our body, it is new to our body. Okay, it is new to our body doesn't have any immune system against this kind of virus. But that is one of the reasons why it is more virulent. And it is possible that since it mutated, the mutated form is more virulent than the previous form. So there are a few reasons. One is, it could be more virulent in itself. Second, it's completely new to our body. So we don't have anything to protect, no antibodies whatsoever to protect against these viruses. So that's why it is new and it is more virulent. Okay, as far as the treatment goes, I know a lot of different treatment is being tried at this moment. I know about anti-malarial drug chloroquine phosphate in combination with a lot of other antivirals, including oseltamivir. There is HIV medication being used for treatment. There are a lot of combinations of other antiviral medication being used, but I'm not aware of other medications. And I know all of these are used compassionately. There are some trials going on, but I don't know the outcome. I don't know the result. I heard that some of them are quite promising, but again, without having a randomized controlled trial and looking at the without looking at the report, I cannot say whether it is effective or what is the outcome. Because as I said earlier, 80% of the people are getting better without any treatment anyway.
I asked the first question because in corona there might be the changing the genetic molecular wise genetic sequence, changing the genetic sequence, the mutants, that's why it's called novel. So I'm connecting this to the test because it is taking around 24 hours to 48 hours by the PCR to diagnose the coronavirus. It will point out that specific point by making a sport kit that can help you identify all that coronavirus and respond. Is it possible?
Can you repeat the question?
I think he was saying that this coronavirus could have mutated from the classical coronavirus, and the diagnostic could have been done using the PCR if the sequence is known. I think that was the thing that he was mentioning. Yeah, of course.
I have a question regarding the use of proper use of masks. Like we have surgical mask which has two surfaces. One surface has the blue color and the other surface has the white color. Previously, in one study, I came to know if you are infected, then wear the mask facing the blue side outside. And if you are not infected, then wear the mask with the white side facing outward. But later, I think WHO just told it's just a hoax. Is there a proper way to use this mask? Okay.
It's not very, the sound is not very clear, but I think he was trying to ask me if the surgical mask is of any help.
No, so so there's a hoax going on saying that, if you are a, so in surgical masks there is blue side and white side, and there is a hoax going on.
This is, surgical mask doesn't help you from getting the infection. It doesn't protect you from getting infection, whichever way you wear it. That's
Yeah.
not protect you from infection.
It's just the hoax saying like blue color is for the infected person and white color is for that's just the hoax.
See the statements from CDC, statement from WHO. There's a lot of people are saying that it's not going to help, and theoretically it will not help.
I have one question. We don't have any cases of coronavirus in Nepal, but we are already lacking personal protective equipment just like surgical masks. So how long we can use the surgical masks? If we use for one day, can we use another day also? How long we can use the surgical mask?
How
long can you use the surgical mask?
I have seen that many of our healthcare professionals are washing the surgical mask and they are using another day. Is it helpful or is it not recommended?
It's supposed to be a disposable surgical mask, as the name suggests. It should be disposable. You should use it once and throw it away.
Yeah, ideally it is disposable, but we are already lacking torsion of surgical masks. We are short of masks. So how long we can?
No, it's the disposable mask. You are not supposed to wash it and use it, basically.
Exactly, yeah. It's not recommended, but can it be helpful or not? Any idea regarding that?
Yeah, like can we dry the mask under the sun for 2 to 3 hours and use it again?
Can you what? Sorry.
Like there is a myth also. Like, can we dry the mask under the sun for 2 to 3 hours and use it again?
No, actually, so I don't think there will be any answer for this, because the disposable mask is supposed to be disposed once used. So I don't think we could answer anything for that.
Actually, there has been some report that if you don't use this mask properly, there is increased risk of you getting infection, because it gives you a sense of false security, and you're touching the mask so many times with your hand, and you're wearing the same mask the next day. The mask itself gets infected. Not with COVID-19. I mean, you can get infected with a lot of other things, and again, it gives you a sense of false security that you're wearing a mask and you're not going to get infection. But if you're wearing the same mask again the next day, you have increased risk of getting infection from the infected mask.
Dr. Prakash, this is Bodh from New York. I'm in the diagnostic front line here. One of the things that currently we have ruled out here is a co-infection. So when a patient comes with respiratory illness, first thing they do is they do the respiratory panel. If something got positive, even with other coronavirus, then the patient is ruled out basically for COVID-19. But in China, in other countries, they have not ruled out co-infection. And also, I think there are some cases of reinfection, which has been ruled out at the most part. But is the policy going to be changed, or what do you suggest? Would there be a possibility of co-infection, or that should be ruled out for now?
No, actually, from a big study coming out of China, what they found is in patient with COVID-19, co-infection rate was less than 2%. I think it's very, very low. So that's why that's one part, and the other part is in United States a limitation of the test. The CDC cannot test all the individuals that come up for the test. That presents with symptoms. So CDC has a strict criteria to test for because they have to prioritize whom to test. So if somebody is really sick and if you rule out everything else or has a very high risk based upon the contacts and based upon the travel, respiratory symptoms, then only you test. Should we have tested more people? Yes, I think so. There was a lot of criticized. CDC was criticized heavily for not testing enough people. If you look at the number of people that's being tested in the United States versus people being tested in Korea, there's a huge difference. But I don't know what is the reason, but there's a limitation on how many people we can test every day. So even in a place where I'm working, there are a lot of people who comes up and says that they are concerned about COVID-19 and they want to get tested, but we cannot test it based upon the symptoms. Every patient we screen, we rule out everything else, and then we called a department health, discuss with them, and when they approve, then only we can send the test. So that's how it's been right now.
Thank you.
I have one other question that's we've been closely monitoring a pandemic of COVID-19 that it shows that the infection pandemic of COVID is more in the same latitude of countries who have the same latitude. Is it coincidence of having the same having those infection those countries who have the same latitude, or there's some scientific reason behind that?
So is the question is the spreading of the disease is in the countries in the same latitude? Is it just a coincidence, or is there some scientific reason for that?
Yes, that is my question.
Right.
Yeah, I saw it in some of the graphs. I'm not sure, but these respiratory viral illnesses, they tend to favor some kind of season. They are seasonal, as we see. Most of them are mostly, in the winter, like flu. They come in winter. Some of them are during spring and fall. So it could be, since they are in the same latitude or altitude, or whatever we call it, they probably have the same kind of weather, and this viral these viruses they favor particular temperature. That could be one of the reasons, but I am not sure, if that has. I don't know the significance to that.
Do we have any more questions online? We have about 5 participants online.
Hi, Roshan. This is Rumi. Can I quickly ask?
Oh, yeah, sure.
Namaste, Dr. Prakash. I'm Rumi, and I work with a nonprofit here, which works with different blood banks in Kathmandu in a non-technical medtech scenario. And I've had a couple of questions come in through donors, from blood donors, who are asking, one, if there are any concerns about transmission through blood transfusion. And second, which is actually even higher concern, a number of questions have come through, because Nepal, we heavily rely on off-site camps for blood donation rather than on-site. There are concerns about, what kind of precautions can we take? What kind of precautions should lab tech folks take? Because we're saying that social distancing is huge. And then now here we are like having blood donation events. And actually I'm running a blood donation event tomorrow. So I'm a little concerned. And I wanted to get in some information from you to see how can we inform donors? What kind of precautions can we take for both of the concerns that they have? And I want to see if you had any thoughts on that.
Well, yeah, so there was a report from AAB, is it what's called?
Yeah, AABB, it's American Association of Blood Banking.
So just recently, about a week ago, and there is no evidence so far that this virus gets transmitted from blood transfusion. Though there was, they detected some viral RNA in the blood, the significance of which is not known, but the disease itself has not been, there is no report of disease being transmitted from blood transfusion. So that's one. I mean, I think they did a study and a lot of patients in China, and there was no evidence. So I think I can safely say that there is no transmission of disease from blood transfusion. Now, as far as the second question goes, yes, the problem in Nepal is, I don't know what is the situation of transmission. There was one case, that's what I was told. Is there any more cases in the community? If we don't have any, then what is there to worry about? But if we think there are more cases, then we certainly need to be more careful on social gathering, and certainly have to have social distancing. Now, to what extent, I don't know. If you talk about United States, there are hardly how many cases? There are 200, 300 cases, or maybe more than that. That is not too many, but now every major event has been canceled in the United States. That is how they are, doing social distancing. That's the extent of what they are doing. In Nepal, all I can say is, if you are sick, try avoid going to any social gathering, any crowd, basically to prevent the spread of disease, and follow very strictly all the hand hygiene rules and respiratory etiquette, and keep washing your hands with soap and water as many times as you can, because that's how you get the disease. It's not through food, it's not through mosquito bite, it's not through blood transfusion. You get the disease through your contaminated hand and aerosols. So just follow the rules of hand hygiene and respiratory etiquette. That's all I can say.
All right. Thank you. Bipinji?
Thank you, Dr. Prakash. Now I would like to request Dr. Vishnu Pari and Dr. Roshan for the closing remarks. Thank you.
Thank you again, Dr. Prakash and the team, and bringing this live session with us and updating about the coronavirus, which is spreading like hell. And we got the new information as well, and we are hoping, as we know that every week or next week we are about to get it. That is the fear every country is having. So possibly we like to see your presentations, your discussions in the future as well. Thank you again from the entire team of Grandy for this excellent presentations and guiding us through this coronavirus 19, that is now the pandemic that has been declared by the WHO. Thank you again.
Thank you very much for that.
Thank you, Dr. Prakash. Thank you all the participants at Grandy, and thank you, Grandy, for providing the venue. With this, I'd like to conclude this webinar, and hopefully we'll see you soon again. Bye-bye.
Thank you.